Within our body, we have many different tissue membranes. These tissue membranes can usually be broken up into three different types: mucous, serous, and synovial. Mucus line cavities that are open to the outside body, and because these are a lot of protected areas, these are going to contain epitheliums, oftentimes simple columnar or a pseudostratified columnar epithelium that have goblet cells within them. And remember, the goblet cells are going to produce mucus, hence the name mucous membranes. These are going to be found in places like the respiratory tract. So air comes in, goes down into the lungs. Again, we have all these particulates that we actually inhale, and we want to isolate them, trap them, and then actually have the ability to exhale them or kick them out, blowing our nose or maybe even coughing. They'll help to get rid of some of that stuff that is present within the mucus that is present. So a lot of the mucus is there to trap microorganisms and protect the lining. Now, within the digestive tract, which is also a mucous membrane, so coming from the mouth again, but going down, say, into the stomach, large intestines, it is also a mucous membrane. In this case, though, we're isolating the membrane with mucus to help protect it from some of our own digestive enzymes, but also risk of infection as well. So if you think of the inside of our stomach as highly acidic, a pH of 2 or 1, if we didn't protect the inside lining of the stomach, we end up with our own stomach acid actually digesting the stomach. And this is what happens when we actually have stomach ulcers. If we don't have enough mucus, we start to digest our own stomach, and we actually end up with ulcers as a result. Now, the next type of tissue membrane is serous, and serous actually covers the inside of cavities, and we've sort of touched on this already. So we had the abdominopelvic cavity with the peritoneal membrane around it. We have the one surrounding the lungs, which is the pleural membrane, pleural serous lining, and then we have one surrounding the heart that was the pericardial serous lining. This is actually made up of a simple squamous epithelium, and its big thing is it's actually going to secrete a very thin fluid that will actually decrease friction between adjacent organs, especially as the movements within these organs continue to take place. The lungs inhale, exhale, over and over and over many times a day. Same thing with the heart, pumping all the time, 60 to maybe 160 times every minute. Then we have the last type, synovial membranes. And synovial membranes we'll talk a lot more during the skeleton, but we have essentially joints here. So here's one end of the bone, other end of the bone, some hyaline cartilage in between. And then we have a cavity where we're actually going to fill with synovial fluid. Now, this inner membrane right in here is known as the synovial membrane. It's actually going to produce that fluid within here, and it's actually going to reduce the friction by lubricating. It's adding oil, essentially, to the joint. In this case, the oil is what we know as hyaluronic acid. It's a highly lubricant type of structure that we've looked at in our proteoglycans. So it's all about, again, decreasing friction. Now, quickly, I'm going to introduce you to tissue damage and inflammation. Anytime we get an injury, and this can be anything from a sprained ankle to a heart attack to a cut, all of it results in inflammation. And inflammation is characterized by four things, really five, I guess: redness, heat, swelling, and pain. And as a result of the pain, we get disturbed function. So if it's in a joint, we may not have full range of motion. We can't bend the knee or flex the ankle as much as we can. If it's an area such as the throat where we have an infection, we're going to have pain, but we're also going to maybe lose our voice. We disturb the function of that tissue. Now, all these characteristics come out of some of the alterations that are going to actually occur in the area. So the redness is going to be to additional blood vessels dilating or actually enhancing blood flow to the area. Same thing with heat. Heat is going to be added as we add extra blood to the area. We allow more blood to the area. That'll actually heat the area a little bit more. Swelling, which is going to be an increase in the amount of water present in a tissue, and inflammatory molecules, is actually going to be due to leakiness that is enhanced of our blood vessels. So actually we're going to get exiting of cells as well as fluid from the blood vessels into the area that will actually allow us to have swelling present. And then the pain is as a result of chemical mediators. So things like prostaglandins down here, kinins, are also going to enhance pain sensation. It is a chemical that will actually react with pain nerves that will actually signal to the brain that there is an injury going on. Now, prostaglandin E is a type of prostaglandin that will actually be shut down by things like ibuprofen or aspirin, Advil, are all going to decrease our pain sensation. So we actually inhibit prostaglandin synthesis and by as a result, decrease pain sensation. Now, the whole thing is triggered really by histamine, and I'm going to go through this here in just a second to trigger this whole cascade of things that will occur during inflammation. So let's start here with an example of a splinter, or really a cut to the skin with a splinter. So as we get a splinter into the skin, we are going to damage this area around it. And as it is damaged, we're going to get a little bit of bleeding, but we're also going to get releasing of chemical factors, in this case, histamine. Histamine is going to initiate the initial inflammatory response in this whole area, and it's actually going to dilate the blood vessels so that these blood vessels enlarge here adjacent the site, and it'll actually also allow them to start leaking. Now, as this blood vessels start to leak, it's going to allow cells to exit, but also fluid into the area. Once we actually have the injury taking place, we also will have release of other chemical mediators like chemotactic factors. Now, chemotactic factors, actually what it means is just means it is going to attract specific types of cells. So these are white blood cells in here, and we'll actually attract white blood cells to the area to help fight off infections. Now, we also will have things like the prostaglandins again that will be released, and this will also help to signal pain into the area so that we perceive this pain not just for the injury that directly results to our skin, but it'll also be determined by how much inflammation is actually present in here. So a large piece of material is going to have more prostaglandins that are synthesized and result longer term pain. Something that's very small and can be removed, it will be relatively minimal. Tissue repair is always going on within the body, and certain cells are constantly being repaired, and other ones are relatively stable until injured. And then we have ones that actually cannot repair, at least back to their original form. So our three different types are labile cells. These are the ones that are constantly undergoing mitosis throughout life, usually because they need to be replaced regularly. So our skin, our stratified squamous epithelium, is constantly being replaced because we're brushing up against things. We're also constantly being under attack by bacteria, viruses, funguses, and we actually will shed that skin regularly to get rid of it, so the deeper layers are constantly being replaced. Our mucous membranes that occur in our digestive and respiratory tract, both again are constantly being replaced. Our intestinal lining is being attacked by acids, by bases, by digestive enzymes that are going to break down our food and also try and break down some of our mucous membranes of our intestines. Hematopoietic tissue, we're constantly making new red blood cells, white blood cells. Red blood cells only survive about 120 days. So that means that they're constantly being replaced. Lymphatic tissue, or essentially our white blood cells, are also being replaced, and so we end up with this being our cells that need to be replaced as they're utilized. If they are fighting off an infection, they need to be replaced. So all these tissues are constantly being replaced. Now, stable tissues are actually ones that are not going to undergo mitosis until they're damaged. And so we're going to be stable until that damage occurs, and then they have the ability to divide. The liver is one of the best examples of this. The liver actually is an organ that is constantly relatively under assault, but things like alcohol will actually damage the cells to the point where the cells will actually need to die. And as those cells die, they need to be replaced. And so as a result, the cells will undergo mitosis and those individual cells will be replaced. One of the other cool things that we have is if somebody decides to donate a liver, a living liver transplant, if they cut off about a third to a half of the liver, give it to a person, a recipient, not only will the donor's liver actually regrow to almost full size, but the liver given to the recipient will also enlarge as a result of having this um, transplant. It will actually come into the recipient's body and enlarge after actually being received by that patient. Now, the pancreas doesn't do this quite as well, but it also has the ability to withstand multiple assaults, and especially alcohol, again, is poisonous to the pancreas, and so we end up with this relatively commonly damaged cell. Then we have permanent tissues, and permanent tissues, if they are killed off, that the cells die, they are replaced by a different type of cell, or really a different type of tissue, in this case, scar tissue. They have very, very limited regenerative ability. So our nervous tissue, like our brain, does not have the ability to have those cells, especially as adults, being replaced. And so if we damage the nervous system, we damage the brain, it's replaced by scar tissue. So this happens in something like a trauma, like a concussion. We may actually kill cells and limit the regeneration of those cells, replaced by scar tissue, but also things like strokes. Skeletal muscle also cannot be replaced if damaged. So if we tear off in a car accident or something like that, skeletal muscle, it is not going to be replaced. If it is crushed, it is not going to be replaced. Same thing with cardiac muscle. Heart muscle is not replaced with similar cells after we have a heart attack. If those cells die, it is replaced by scar tissue. And so instead of being a nice, efficient pump, now we have part of the heart muscle that will still pump, and part of it will actually be scar tissue, and so it will be relatively non-functional. Now, skin repair is done in two different groups. Primary union really means a small cut. So think a paper cut, something where the edges are very, very close together. A secondary union is where the skin edges are very, very far apart. Think of more like a pressure sore or a pressure ulcer that might occur in somebody who's been in a wheelchair for a long time or bedridden for a long time. So let's first look at primary union. In this, the edges of the wounds are close together enough that essentially blood, which forms a clot, can fill that space in between. Now the clot forms, and it actually will find a meshwork in between the two edges that will actually pull the edges closer together and actually help to form a bridge. In this case, what we call a scab. Now, we also get an inflammatory response in that area. As white blood cells come in, they actually attack an infectious material or the area, and as they die, they actually release pus. And the reason pus is white is because it's white blood cells. Now, as we actually have repair occurring, we're going to get a connective tissue with fibroblasts invading the area, putting down collagen fibers, and capillaries into the area. And this is what we call granulation tissue. Think of it as a scaffolding to replace the material that was just damaged. Now, scars do form. With something like a paper cut, we're not going to get a very, very large scar. But if we have a scar that is a relatively large cut, we'll end up with this scar formation from the granulation tissue because the tissue never quite comes all the way back to an epithelium, a stratified squamous epithelium, as we've seen before. But we also will have the tissue turning from red to white as essentially the capillaries are forced back out, and it essentially becomes a dense, irregular connective tissue. Now, secondary union, again, the wound edges are not very close together, and so it's really a harder healing process to occur, and there's a greater chance of infection getting into there. Now, when we have this opening, oftentimes the clot does not close the gap, so we get an open wound that will stay open for a long time, again, increasing that risk for infection. In this case, because the wound is also larger, we also get a larger inflammatory response. This means larger amounts of redness, heat, pain, swelling, and limited function in that area. When we actually finally get the wound healing to occur, we get a larger wound contraction, pulling the edges more and more from the sides towards the center, which means we get a larger amount of scarring present because we have this large area in between. And so oftentimes we get this kind of irregular or maybe bumpy looking type of scar. So again, a pressure ulcer, a pressure sore, bed sore is the more common name. So here we look at primary union. Here's the skin, our stratified squamous epithelium. Here's our dense, irregular, collagenous connective tissue with blood vessels within it. We get a cut. The cut is filled with a clot. Okay, that clot is actually our scab that we see. Now, as it hardens, the edges are going to be pulled a little closer together, and you can kind of see it gets a little bit smaller here. Now, during this time period, we're actually going to get replication of the skin here and here near the basal layer, and these cells will actually work their way underneath. And this is what you see happening here. The skin is regenerating from either side, growing underneath. Now, at the same time, we are actually getting a invasion of red blood cells, but also invasion of fibroblasts into the area as well as white blood cells. This is going to help to provide the structure for the underlying repair down in here. Now, as this gets more and more prevalent with the fibroblasts, but also the collagen within here, form a dense, irregular connective tissue. This is what we call granulation tissue. Granulation tissue just means there's blood vessels, collagen, white blood cells, all present within here, trying to get that healing to occur. After a while, we actually have the scab forming all the way through here, but we also have skin underneath here. The skin that has grown underneath the stratified squamous epithelium has spread all the way underneath, but if we scratch at the scab, because this layer is usually so thin, we actually might damage the underlying granulation tissue and get rebleeding. But if we don't touch it, the skin will tend to continue to proliferate, that stratified squamous, and eventually we replicate that same skin across the top, but we have a dense layer of this granulation tissue. As the blood vessels are pushed out of this area, we'll actually end up with it turning from reddish to whitish, and that's where the underlying color of skin is returned to its original shape and form. This is just a video explaining the inflammatory response from injury all the way through to blood cells coming in, giving us that redness, heat, pain, swelling, as well as limited functionality. Now, tissues are, well, we're always aging, but we have a lot of effects on tissues. One of the biggest things is that our cells divide more slowly. This means that our cells, if injured, we'll have a harder time recovering. So if we are in our 60s or 70s and we cut our skin, it takes longer for that healing to occur than if we are 18 years old. Now, the collagen fibers also tend to become more irregular, but they also may increase in number, actually replacing some of the elastic fibers. Now, one of the things that as the collagen fibers become more irregular, meaning they're not running in a single direction anymore, things like the dense regular connective tissue are changed, and it makes the tendons and ligaments less flexible, okay? And they're actually more likely to tear, but they're also less elastic. Even though they have a very limited amount of elasticity, it makes them more fragile. Elastic fibers tend to actually bind to calcium ions, and this makes them less elastic. Think of this as like an old rubber band. Initially, a young rubber band, stretch it, stretch it, stretch it, no problem. Once we calcify or add calcium to this elastic fibers, it makes them less likely to stretch and makes them actually more likely to break, or what we call plastic deformation. So if you think of blowing up a balloon that has elasticity to it, right? You blow it up maybe 10, 15, 20 times, but after you leave it inflated for maybe a couple of hours, and then if you deflate it, you'd actually end up with this stretched out, odd-shaped balloon where maybe you get wrinkles, right? So as we lose elasticity in places like the arterial walls, we actually can get some plastic deformation as those artery walls actually enlarge, and we can get enlargement to the point where it actually can rupture. So When we get these changes in collagen and elastin, we can get what is termed as atherosclerosis, hardening of the arteries. This actually ups our blood pressure, but it also reduces the blood supply to tissues. So this can cause things like a heart attack or stroke. We also get more wrinkling in the skin. When you're young, your skin can bounce back because of the elasticity of the arteries. As you get older, that elasticity is lost, and so people tend to have skin that hangs in very odd, different ways. Red blood cell synthesis also declines, meaning that they have the more limited ability to carry oxygen and carbon dioxide. Also, less of an ability to neutralize acids, things like that, but also just less of a tendency to actually be able to carry the nutrients that we actually need. Now, all these really add up to the big thing: injuries don't heal as well. So, as we age, we don't heal as well.